Hello, dear colleagues and friends. I'm Dr. Liping Liu from Beijing Tiantang Hospital, Capital Medical University. And thanks for the kind invitation today. And I'm going to be talking about the impact of COVID-19 on stroke care in China. This is my disclosures. As you know, the Wuhan is the capital city of Hubei province. It's blessed with a long history and proud of the tremendous culture and the charming nature beauties. But as unfortunately the COVID-19 outbreak in the early 2020s, and we are lucky at the last moment, the key decisions were made by the central government and all of the people across China. So we can see here from the COVID-19 statistics is the number of the suffering is increasing, especially during the first couple of months, and the cumulative cases are reaching nearly over 10,000 in the mid of 2020s. But it's keep at the same platform, the number without any increasing of the peak. So, what can be performance during the pandemic for these stroke patients? First of all, we were rapid action for the collaboration from CSA and WHO for the webinar, inviting a couple of the experts and leadership for the further discussion how to handle the stroke care across the world during the pandemic. You can see here the leader experts from CSA and WHO and AHA, and especially a couple of my Chinese colleagues who working in Wuhan, Professor Hu, Professor Chen, and also join us for the further discussions. The aim of the discussion were trying to figure out the approach of the global stroke care during the pandemic, and there are a couple of the interesting topics were discussed. Does the COVID-19 cause or the impact to stroke? Any difference of stroke subtype, and there any advantage or improved performance of the workflow in during this specific period? What there are true prevalence of COVID-19, also the cerebrovascular diseases, how to triage, and if there are any special population of the high risk stroke suffering during the pandemic period. What the impact of the potential reduction of the reperfusion, either the intravenous TPA or the endovascular treatment. So sounds like a lot of questions we need to figure out. We are happy to see my Chinese colleague from Wuhan to provide the very excellent data regarding the neurological involvement from COVID-19 patients. So this paper was published in early 2020 in JAMA Neurology. We can see here if the patients were diagnosed with COVID-19 were suffer from the new lesion on the left side on the CT scan, which was diagnosed of the cerebral infarct. So patients with COVID-19 will commonly having neurological disorder involved, but during the pandemic, when the patient screening with the or presented with the neurological symptoms, so the physician should be screen or test the both respiratory symptom for COVID-19 or also the cerebrovascular diseases. So another paper published in ISBN, the official journal of Chinese Stroke Association last year, still from the Chinese colleague from Wuhan, and presenting a couple of the cases who were diagnosed with CVD, and we can see there are different subtype and the presentation on site, and most of them were old age and with the moderator and severe stroke severities. And we can see on the image CT scan on the imaging on the right side, both can severe lesion either in the brain or chest CT, but the stroke were can be seen either the ischemic or hemorrhage. So, so based on the experience in China and early last year, we are providing the couple of the data or the statement regarding the stroke care and the COVID-19. Here, the expert experience from Beijing Tiantang Hospital, we provided a couple of the key points for the patients who suspect of cerebrovascular disease. How can for the screening or the testing the patients who suspect stroke, if they came in the emergency room, we can see there are a couple of the key points, including the administration office and triage and their comprehensive control system, pretesting on triage. And also we can take the advantage of the fever clinic, and also the improved operation room system of the lab service, and also it's really important of the monitor and feedback. So here the couple of the flow chart of either in the emergency room or the operation room. It looks like complex flow chart here, but we trying to figure out the different category for patients with suspected COVID-19 positive or negative. So it's really helpful for the clinician for manage those patients who came in the emergency room. And also we are providing the expert consensus on COVID-19 control in NICU. The most of the severe stroke or the neurological disorders or should be admitted to NICU, especially for acute stroke, who need the emergency reperfusion therapy. So we're providing the flowchart like this, trying to figure out the patients in the acute stroke and others. And if the patients were mostly suspect to COVID-19 positive or not, if the patients really need the intravenous TPA reperfusion or the endovascular thrombectomy, so the patients were driven to the different direction or the area. So it's a key principle here, the general screening and nuclear IC test is the first choice, and trying to balance the benefit or harm to the patients if they make the decision of management. And rapid management of workflow with the comprehensive assessment is the first level of the high priorities. So I would make the summary of the data and the information here. And from the observation data or the experience from China for stroke care, and acute cerebrovascular disease is not common um, uh, during COVID-19 pandemics. But there looks like some risk factor will be increasingly more likely to develop uh, for the stroke if the patient suffer from the COVID-19, especially the age, the patients who had a history of stroke and something like that. So it's absolutely further study to identify the optimal management strategy for stroke care in COVID-19 outbreak, and we'll be providing more data of the research direction in the near future. Uh, that's my presentation. Thanks for the invitation, and hopefully the meeting successful. Thank you.